So my role at Ramsay Healthcare is working for North Shore Private, and that role exists as a nursing unit manager within operating theatres, which means I run the floor. So every day I start at 1:30 and I receive a handover from my colleague who runs the floor in the morning. And then it entices me to get out there and go into all the theatres, which is 16 operating theatres, and introduce myself to all the surgeons, and that is all the surgeons who pretty much already know me, and to just make sure that my presence is felt with all the nursing staff. With North Shore Private, I've been with them for coming up 10 years in November. So the position that I hold now, I started about 8 years ago. I was first working at another private hospital, and I was contacted by a woman who introduced herself as a HR from another private hospital, and she would like to meet up and have a coffee with me. And after that meeting up with her, I ended up leaving my previous job after 2 weeks and starting at North Shore Private as a coordinator in general. And then I went to plastics as a coordinator, and then I started to take the role as a floor manager. And then through the years, I have just stayed as the floor manager, but watched theatres grow from 8 theatres to 16. I had been looking at North Shore Private for the previous years, and the rumours that were going around about the expansion and how big North Shore Private was going to be. And that would have opened me up to massive opportunities. A typical day, I get a handover. The handover tells me what is happening in every theatre, every 16 operating theatre, and all the additions that have been added on that day. And sometimes my job, a majority of the times of that job is to juggle where I'm going to be putting those additions. As the day goes on, every theatre is always unpredictable, and every case is unpredictable, with being the length, the time, or the outcome of the operation. So I need to juggle where I'm going to put the additional cases, and to make sure that all my staff get all their breaks, and that we have all the equipment and all other needs are met, so we can continue on and hopefully get all the cases done by 9:30. I love working for Ramsay. Ramsay offers you the opportunity to move through their 69 or 67 hospitals through Australia, Indonesia, England, now France. There's that opportunity to move, and there's that opportunity to grow as well, with not just the one hospital you've started in, but moving to another and having those opportunities where you can grow from there. I think that is the biggest thing for me. For someone who wants to get into nursing, I think, the big thing is that you need a degree. You need to pick your university, you need to complete your degree, but to get into Ramsay, I think you need to have your heart in nursing. If you want to be a nurse and look after people for the rest of your life, that is always going to be there. But if you want to if you want to move through the ladders, if you want to sidestep to other areas or other specialties, there are just hundreds of opportunities within Ramsay to do that.